Hello there and welcome back to another blood transfusion CPD talk. My name is Jasmine. I would like to start off by apologising for the long break in videos. Anyone who works with me is aware that we have had a lot going on. We've got new analyzers come into play, so we've had a bit of a backlog of work to catch up on. I'm hoping over the next few months we will return to the usual number of videos. But it might take a little while to catch up on everything. So today I'm going to do the first presentation of a two-part series on blood donation, going through the pre-collection, collection, and how the blood components are actually processed from that whole blood donation. So going through it, the topics that we're going to cover are why blood donation is essential, the types of blood donation, pre-collection and the collection process, a summary, and then in part 2 we're going to go through the blood component processing. So this first part of the presentation is going to be a lot more generic and just information on the donation process and how important it is, and the second part is going to be more going into the science and how we actually take your blood donation and it's separated out into the different parts. So let's get started. Why is blood donation essential? When people are seriously unwell or have been seriously injured, they often require blood transfusion to help in their recovery. When we talk about blood transfusion, people often only think about red blood cells, or RBCs, as this is the most commonly transfused component. Transfusions of red blood cells allow us to increase people's hemoglobin, which is what transports oxygen around the body and ultimately to our organs like our brain, muscles, liver, stomach, etc. It is essential for our body to function correctly, and during blood loss, it is the loss of red blood cells that ultimately lead to death. However, when we donate blood, we do not normally just donate red blood cells, we donate what's known as whole blood. This term is used because we're donating all of the blood components. This donation will then undergo separation into different types of blood that can be used for different circumstances. So these include the red blood cells or packed cells, platelets, plasma, cryoprecipitate, and then there are some more specialist components, so like granulocytes. I'm going to go through a couple of them. So as I said, white blood cells or granulocytes can also be used as a component, but this is very rare now and is not routinely obtained from whole blood donations anymore. You can see here I've included a picture of the composition of the blood. It's a very generic one where you can see you've got the red blood cells, you've got plasma, which is the yellow stuff which has a lot of important factors in it, platelets, and white blood cells. So while red blood cells are the most commonly used component, the others are equally as important in patient care. Platelets are used to help patients' platelet levels be boosted. They are essential in preventing spontaneous bleeding and allowing blood to clot. Again, these can be used in emergency situations because when someone is bleeding, they'll be losing all of their own blood components, including platelets. But they are also frequently used for patients on chemotherapy, as this treatment can lead to reduced amounts of platelets in the circulation, therefore leading to the increased risk of bleeding. Platelet stores are often low, as one whole blood donation will not contain enough platelets for a whole bag. Instead, we pool between 3 and 5 whole blood donations to create a pool of platelets. There is another method of donation where you can do a direct platelet donation via apheresis, and that's how we get apheresis platelets. Plasma products are used for similar reasons to platelets. Plasma contains clotting or coagulation factors that allow your blood to form clots through the use of platelets. Therefore, if you do not have enough of these factors, you will not be able to stop the bleeding. This can occur due to trauma, or it can be due to factor deficiencies. Plasma is normally frozen to ensure that these factors do not degrade over time, so it's most commonly called fresh frozen plasma, or FFP. It's also important to note that in major trauma situations, You want to try and keep the patient's ratios of blood components similar to what they're losing. If you just give the patient red blood cells, then they're not going to have enough plasma in their blood to help suspend that. Which is why quite often during massive blood traumas or when people activate the massive blood loss protocol, there will be ratios that are maintained within that, not only for the coagulation factors, but also to make sure that the ratio of blood to plasma is maintained. Finally, cryoprecipitate is similar to FFP in that it contains coagulation factors and is frozen, but FFP has multiple factors within it, whereas cryoprecipitate is a highly concentrated source of fibrinogen, therefore targeting a specific factor, and is used in specific cases where the patient has low levels of fibrinogen. So we've discussed the types of blood components and why they are essential. As a part of that, we touched on different types of blood donation. So there are two main methods of blood donation. You've got whole blood donation, and then you've also got apheresis blood donation. And then within these two different methods of blood donation, there are different types of blood donation which span both of them. So you've got autologous donations and directed donations. Whole blood donation. This is the method that most donors use and that is advertised most often in the media. Whole blood donation involves the donor giving approximately 470 ml of blood over 5 to 10 minutes. This blood is then later processed into its different components depending on the need and the donor. Apheresis donation, however, is a method of donation one type of component and having the rest of the blood components returned to your body. This is a time-consuming process, but results in bigger donations because more of the platelets or plasma can be removed without having negative effects on the donor because we're returning the red blood cells to the patient's body. You can see here I've included a picture of the apheresis process. It's a very basic picture, and if you are interested in donating in this way, I would recommend talking to the person who takes your blood when you next go to donate. Quite often, suitable candidates are advertised to after they've donated a couple of red blood cells. But you can see your whole blood is collected through an intravenous tube in one arm. The blood passes through an apheresis machine, which is what separates the cells out. The cells are then collected for storage, so in this case platelets is what they're talking about, and the remainder of the blood and plasma will be returned through an intravenous tube in the other arm. I'm then going to talk about autologous donation. This is not routinely performed in the UK anymore, however it used to be a standard procedure, and in some other countries it is still standard. This is blood donated for the donor's own use, usually in preparation for an upcoming elective surgery, and normally people wish to perform an autologous donation to reduce the risks of transfusion-associated diseases. However, if incorrectly managed, this process could result in the donor having a lower HB pre-procedure and therefore result in increased risks during surgery. In general, if you go into surgery and you have a low hemoglobin before they cut you open, you're at a much higher risk of having bad outcomes of that surgery than if you go in with a very stable, good, healthy hemoglobin level. You then got directed donations. This is very popular in the USA, and it's when you've got blood donations that are made for a specific patient. In the UK, these are most commonly used if there is a patient who requires an extremely rare type of blood for transfusion, in which case the blood centres will contact possible donors from their register and advertise for donors to come in to donate specifically for this patient. So an example of this would be if you have a patient with a really, really rare antibody towards a high incident antigen. So this is an antigen that 90% of the population will have on their red blood cells, and therefore it's more difficult to find blood that's suitable for them and won't cause them to have an adverse event as a result of a transfusion. These can also be used if the patient requires Hla Match Platelets. So Hla is a different type of antibody-antigen interaction, and it basically means that patients that are given just normal platelets, their platelet count isn't going to increase in the same way that you would expect it to, because they've got this interaction. So we would select specifically matched platelets. Also, sometimes the same patients are used to donate for neonates to allow there to be fewer risks because they're not exposed to as many donors. Normally though, just long-standing donors are used, as their prior history is used to confirm that they are safe as a donor. And as I mentioned, if the patient has an antibody to a high incidence antigen. Those are the main different types of blood donation, obviously not including the standard you go and donate and then it's tested and just sent to the local hospitals as needed. So we have established why transfusions are essential and the types of blood donations that exist. But how do we get people to donate? Educating the country on how to donate and the benefits of blood donation is really, really important. So a lot of work goes into reaching out to new donors, making it easy to find somewhere locally to donate at a good time for them, ensuring that the environment on the day is pleasant so that donors want to return, and trying to book in repeat appointments on the day as opposed to relying on someone to come back and sort it out in their own time, reminding previous donors about attending again, and having incentives to encourage repeat donors. For example, in the UK, this is the generalised layout of what you get for the numbers of donations. So when you first donate, you get a welcome thank you pack, including a little card, a key fob. On your 5th donation, you get a bronze card, and so on and so forth. This does change, so I don't know if this is what the current standard is, but in general, you get different little rewards each time you go. And I know that when someone has been present and they're giving their 100th donation, they normally give them a round of applause when they're giving it, because it's such a huge achievement. So we've reached out to donors, great, but there's a lot of restrictions on who can actually donate because of safety for the recipients of these donations. So I'm sure everyone has heard of the HIV scandal of the 80s, where HIV was transmitted to many unsuspecting patients who received blood donations. So it's for this and many other reasons that there are strict criteria in place that allow or prevent certain people from donating. These are reviewed very, very regularly because research information is currently changing. So it's important that we keep up to date with the most current information out there to make sure that people are kept safe, and also that we're not excluding donors unnecessarily. So I've put in here, it's a bit squished, but this is an example of the questionnaire that you have to fill in. But again, these are updated very regularly. So if you do go to donate, have a look. They'll normally send it to you in advance. Make sure that you do meet all of the criteria. And if you don't, maybe call them up and let them know so that your spot can be given to someone else. The actual collection process. All donations will follow the same basic preparations. The donors book their appointment on the day they check in and have to read through information booklets, complete their questionnaires if they haven't brought it with them, and drink at least 500 ml of fluid pre-donations. Once they've completed this, they will go into a private area, be questioned on their answers to the questionnaire, and if donating whole blood, have their iron/hematocrit tested. So this is a way of giving us a hemoglobin level. So the HB should be at least approximately greater than 12.5 and the hematocrit of greater than 38%. Hematocrit is the ratio of blood to plasma. Their pulse will be checked, and so will their blood pressure. Again, it's about the safety of the donor as well as the recipient. We don't want to take blood off of someone that might faint as a result of it or end up in a worse case. If it's a whole blood donation, once the pre-donation checks are complete, the patient will be seated at a donor station where they will have someone confirm their details again. A pressure cuff or tourniquet will be used, and a phlebotomist will clean the needle site with an alcohol wipe before inserting the needle and securing it in place, which is the worst part. I'm sure everyone will agree. The needle is connected to a series of tubes. first part of the donation will be taken into a separate bag which is not used. This is to remove the skin plug, which can be contaminated with bacteria. So obviously when you go to get any blood taken, when they've put that needle in there and the bevel, it does remove some of your skin. And obviously your skin is going to be the bit that's got any bacteria on it. And if that goes into the main blood donation, then there's a higher risk of bacterial contamination that could be passed on to the recipient. So they have a separate bag that takes that off. And then there will also be some samples that are taken. So the samples will be used to confirm the donor's blood group, check for HIV, all of syphilis, HCV, many different disease markers, and also extra samples in case other testing is required. Now, although they do test for HIV and other diseases, it's important that if you are worried that you have any of these, that you go to your doctor and don't rely on these tests as a way of confirming whether or not you have it, because they're just doing a wide screen of things instead of actually looking for something based on your symptoms. So please do not use blood donation as a way of getting a test for one of these. Once this is completed, the whole blood will be switched over to flow into the main donation bag, which is on a rocker, so it agitates it. It ensures that the donation is properly mixed with the anticoagulant, so you don't end up with clots in the blood, and monitors how much blood is being donated, so that once the bag is full, it makes an audible noise to alert staff that you are finished. And then the staff can come and help you up to your feet, take out the needle, and bandage you up. And then you'll be allowed to stay for as long as you need. There are normally beverages and snacks provided to ensure that you feel better before you go out and get into your car, for example. Going over to apheresis donation, this is a technology by which blood is processed by the apheresis machine. You saw I gave that little picture. The minimum platelet count for this donation, because it is most commonly used for collection of platelets, is 150 times 10 to the 9 UL. The process of donation takes about 2 hours from the start to finish. And before donation, fatty foods, platelet antagonists such as ibuprofen or aspirin should all be avoided because they can cause issues with the actual donation. Donating 1 unit of platelets can take up to 90 minutes. They take you to a donation chair and lower it so you're lying back slightly, put a cuff on your arm, and maintain a small amount of pressure throughout your donation. They will clean the skin before inserting the needle in the same way that they would with the normal donation. And the machine will spin your blood around to remove the platelets, which will then be stored in the bag that's going to be used for your donation, and the rest of the blood is returned to your body. While you're donating, you can watch TV, use your phone, read a book, or just relax. They keep a close eye on you, and if you do feel uncomfortable at any time, then they will stop the donation. As red blood cells are returned back to you straight away during your donation, you can donate platelets more often than you can blood. And again, snacks and drinks are available throughout your donation. Platelets can be donated once a week or up to 24 times a year, so a lot more regularly than blood. That is a basic overview of donating whole blood and apheresis blood. Blood transfusion is an essential part of healthcare, so blood donations are vital to allow us to continue to treat patients effectively. There are many types of donations, and blood is made up of many components, all of which are required to help our patients recover. Thank you all so much for listening, and stay tuned for part 2, where we will go through how the different blood donations are separated into their components, and a bit more about how they're all used. Thank you very much for listening, and I will see you in the next one. Bye!